Hello, veterans. I have quite the statistic for you today. Did you know that about 25% of the VA's population has diabetes? I know, it's a lot. But you may qualify for a 100% VA rating if your diabetes is the direct result of your military service. It's Kelly here from VA Claims Insider, and today I'm diving into what you need to know about getting the VA rating for diabetes that you deserve. But before I get started, don't forget to hit that subscribe button so you don't miss our latest content here at VA Claims Insider. Okay, on with the show. The VA rates diabetes at 10, 20, 40, 60, and 100%, depending on factors including your blood sugar control, complications related to your diabetes, and how it affects your daily life and ability to work. Let's look at that a little bit further. If you can manage your diabetes with a restricted diet, you may qualify for a 10% VA rating. However, if you require insulin and a restricted diet to manage your diabetes, you may qualify for a 20% VA rating. If you require insulin, a restricted diet, and must regulate your activities, you may be eligible for a 40% VA rating. To obtain a 60% VA rating for diabetes, you likely need insulin, a restricted diet, and regulation of your activities, along with frequent healthcare visits. Finally, to qualify for a 100% VA rating for diabetes, you need more than one daily injection of insulin, a restricted diet, regulation of your activities, and multiple hospitalizations yearly. Something else to consider is the VA disability rating for diabetic neuropathy, which ranges from 10 to 80% depending on the severity of your condition. Many veterans with diabetes develop some degree of neuropathy where one or more peripheral nerve is damaged. Usually, veterans are rated 10 to 40% for peripheral neuropathy, but the rating could be up to 80% if you have severe symptoms, for example, complete paralysis. Now, unfortunately, health problems often lead to other health problems. This is what the VA considers a secondary condition. This means your diabetes caused a second condition, and you may be entitled to additional compensation if you can prove a link between your two conditions in regards to your military service. Some examples of secondary conditions to diabetes include high blood pressure, kidney dysfunction, coronary artery disease, stroke, heart attack, and nerve damage. In addition, the VA considers diabetes a presumptive condition because there's an established link between exposure to Agent Orange and diabetes. A presumptive condition is when the VA presumes that your medical condition was caused by your military service. And with presumptive conditions, you don't have to provide that medical nexus linking your condition to your military service. So what type of diabetes are we looking at? Well, there's three main types. Type 1 is caused by an autoimmune reaction resulting in your pancreas producing little or no insulin. Now, type 1 diabetes is usually diagnosed in early childhood or adolescence. Type 2 diabetes, or adult onset diabetes, evolves due to lifestyle factors or genetics. And lastly is gestational diabetes. Pregnant women who develop high blood glucose during pregnancy are at risk for gestational diabetes. Now, while gestational diabetes usually resolves itself after birth, women with gestational diabetes are at a higher risk for type 2 diabetes. In addition, research shows that PTSD diagnoses are associated with an increased risk of gestational diabetes and high blood pressure during pregnancy. What sort of symptoms should you be on the lookout regarding diabetes? Excessive thirst, weakness and tiredness, frequent urination, sores that don't heal quickly, and blurry vision. If you suspect you have diabetes and these symptoms sound familiar, it's important you book an appointment with your healthcare provider. They can do the appropriate blood work and tests to determine whether you do in fact have diabetes. Now, the good news is there is treatment for diabetes, especially when early detection occurs. Treatment methods include restricted diet, insulin injections, and medication. If you developed diabetes as a direct result of your military service, you must service connect your condition. What does that mean, Kelly? You need to prove the following three things. Number 1 is a medical diagnosis of diabetes. Number 2 is an in-service injury, event, illness, or aggravation. And lastly is a medical nexus or link between your condition and your military service. Once you have your official medical diagnosis, you can begin filing your VA claim. While the easiest method is to jump online at va.gov, you can also mail, fax, or drop off your application at a local regional VA center. Remember, if your diabetes is directly linked to your military service, you may qualify for VA disability benefits. Don't leave money on the table. You served and you deserve. As always, I appreciate you joining me.